Okay, so I shared briefly before my kids went with their daddy to go get some sweet treats. I shared on my personal page a quick Facebook Live that discussed me coming on to this community page, which was one of the social media platforms that was born out of my near-fatal accident that I had on December 15th, 2010, when I was hit by a semi-truck on the expressway at 65 miles an hour. I also want to talk about what I have seen as a patient along the way, being trained as a doctor. I want to talk about the book that I wrote in 2017 that's still sitting in my Dropbox that I'm going to have a couple of chapters that I need to add to it. I'm going to talk about in this time that we have here together how the pieces in my life and my journey going all the way back to my childhood are all starting to fit together right now. And as somebody who has now been dealing with daily chronic pain and other consequences from a near-fatal accident for over 8 years now, it has been overwhelming to gain answers and to be connected with people, including a new physiotherapist who has both Ehlers Danlos and POTS, who truly understands what I'm going through. So I just want to go over a little bit of a timeline, and I wrote it down because, one, I'm out of breath, which is related to Ehlers Danlos. May is Ehlers Danlos Awareness Month. And as a doctor in medical school, we do not get much training in regards to connective tissue disorders. Most doctors, and this was written in a report of mine within my medical charts, I have over 2,600 pages of medical notes. Dr. Caroline Courtley, who is a visiting doctor here from Canada, she specifically documented in her notes that most doctors have very limited to no knowledge about Ehlers Danlos Syndrome and other connective tissue disorders. In medical school, we learn about Marfan syndrome, which is usually like a tall high school basketball player who ends up dropping dead, and that's due to a connective tissue disorder. But Ehlers Danlos in medical school, I had very, very limited teaching on this. And I look back at my own life, and as an individual, from the time I was a child, there were issues, and I've sought answers. And it's taken me 37 years for these pieces to fit together. And Ehlers Danlos, I learned, is most often not diagnosed until after the age of 40. So that means for up to 40 years, people can suffer, be turned away, not listened to, and dismissed about a debilitating condition which affects every single system within the body, and it affects everything in regards to daily living. And there's a spectrum of severity, and there's different types, there's different classes of Ehlers Danlos. I most certainly have the hypermobility type, and you're really not supposed to show your little tricks, but one of the things that I can show you, which is not normal, is just simply the extensibility that I can move. I can do that with my skin too. I can pull my skin really far away from my body. So anyway, before I've been on, my accident really set everything off for me. And if you're tuning in, listening to me, say hi. I appreciate people listening in. If there's somebody who can relate to the things that I talk about on this broadcast, please share this with them, because as a patient who's seeking answers, who's suffering, who isn't being listened to, I know how much additional pain that causes. And it is also Mental Health Awareness Month. And dealing with these issues most certainly affects your mental health. So later on, I'm going to bring my husband on, and we are going to talk about our journey together, because my accident happened 2 weeks after we were married. And my husband has seen me go through this entire journey, and it has been incredibly difficult. So, fitting these pieces together, I currently have my disability case with the Hartford Group, which is my long-term disability that was taken out when I was employed as a resident doctor. That is at the level of the U.S. federal court with a disability attorney currently. I have had, like I said, I have over 2,600 pages of medical notes currently. I have had to go through independent medical examiners. I've also went through a lawsuit with the trucking company of the truck driver who hit me, and that fell in my favor a couple years ago. And I had to go through, my phone records were subpoenaed because the truck driver lied and said that I was on my phone, which I was not, and my honesty prevailed in that situation and many others. I went through depositions. I dealt with the horrific things that defense attorneys will say and how they will try to basically dismiss everything that you've gone through. I've gone through defense attorney and independent medical examiners, which basically, for people who don't know what an independent medical examiner is, and some even ethical doctors don't even know what it is, it's a doctor that is paid by, say, an insurance company or a defense attorney to write a report that assists them in their case. And defense attorneys don't want to lose their cases, and insurance companies don't want to pay their claims, as I have seen very painfully. So anyway, I'm going to take you up to the week before Easter, where I ended up in the hospital in the ER 3 times. The first time was after having a urinary tract infection, which I've had since I was a little girl. I've had chronic UTIs. I had one that ascended to my kidneys when I was in 4th grade, and that is called pyelonephritis. It was a kidney infection, and it was extremely painful, and I was hospitalized for a week. Bladder issues are connected to Ehlers Danlos, along with a bullet list of over 21 other points that I've written down and shared here and on Instagram, and I'll go through those. So I went in and I was using, for chronic pain, because I've had adverse effects to other medications, other pharmaceutical medications, I was using CBD oil. And CBD oil, on the whole, helped me. It allowed me to finally get sleep after 8 years of never being able to get good night's sleep, because I was in so much pain. I would just flip-flop all night long. I could never get a good night's sleep and go 8 years without any good sleep, and it wears on your soul. And then in addition to that, before my accident, I was in residency and I went through medical school. So my sleep had been disturbed for over 12 years, but since my accident, really, really bad. So the CBD oil helped me with my sleep. Getting sleep allowed me to get stronger, and of course, it made me feel better. I didn't feel like I was in this constant fog, which helps as a mom and a wife. But I also had reactions to the THC in it. I have a very sensitive system. So I went to the ER, was treated for the UTI, ended up having a reaction after that. And I thought it might be due to the Augmentin that was given for the UTI. The ER doctor didn't think so. I did more research, and yes, CBD oil can amplify the side effects of any other medication that you are prescribed. So I stopped taking the Augmentin after having had it in my system for 3 days, and it killed the UTI, so that was good. However, then in a couple days, I ended up having another reaction, and I was experiencing dizziness and feeling faint, and I went to the ER and saw an ER doctor, and with our insurance, that's the only option for us. We have to go into the ER. So he ended up speaking to my pain specialist, and we found out that there's a supplier issue with CBD oil here. And so you can't, because of federal regulations and because of legalities with CBD oil, there is no way that they can test the purity of the CBD oil. And what seems to have happened is that the new supply that they got in may have had more THC than the supply before. And I appear to be sensitive to it. So then I was told to cut down that dose. So then a couple days later, I had another extremely amplified response after taking some oil. And what would happen is, like, my face would go numb, it would affect my vision, be really short of breath, feels like a panic attack, but my chest felt numb, absolutely terrifying. And because we don't have any health here, we're expats, we have our little kids, we don't have any family support here, all 4 of us go into the ER. And before I went that time, though, I'm in group of doctors who have Ehlers Danlos, and they also have a condition called POTS. Many of them have POTS. There is a strong link between Ehlers Danlos and POTS. And so I did some more research on that, and a lot of the symptoms that I was showing mimic POTS, the dizziness, the lightheadedness, feeling like you're going to faint. And so I went into the ER this time, and I had a different ER doctor, and I discussed this with him. And many times POTS, postural orthostatic tachycardia syndrome, many times doctors write it off as a panic attack. And after my accident, I did have panic attacks, and this was different. And thankfully, this doctor in the ER listened to me after initially thinking that it was a panic attack. So what he ended up doing, he gave me fluids like I had asked. He gave me a consult to a cardiologist. He did an EKG and measured my blood pressure, because each incident I went into the ER, my blood pressure had been elevated, which is very abnormal for me. Even while I was pregnant, my blood pressure remained low. So I ended up going to see the cardiologist. She ended up doing an echocardiogram. So here where we get more answers. And she also agreed with the strong possibility of me having POTS in addition to Ehlers Danlos syndrome. So Ehlers Danlos, you have an issue with your collagen. The only good thing about it is it makes your skin look nice and you look younger. But other than that, there's a lot of other issues that go along with it. So in doing the echocardiogram, she was able to diagnose both mitral valve prolapse and mitral valve regurgitation within my heart. That is very commonly directly related to collagen issues and Ehlers Danlos. She also referred me to get a tilt table test done, which will basically assess my blood pressure and my heart rate at different angles on a table. I was going to have that done today, but I will be testifying in my former medical school dean's criminal trial very soon. And so I didn't want to take the risk having such a sensitive system. I didn't want to take any risk of having an adverse effect to the test or the medication that they will administer to see how my body responds to it, so close to having to testify in this criminal sexual assault trial. So I will be having that on June 8th, and I will get more answers from that. However, today I saw my physical therapist, my new physical therapist, and she's been here for about 2 years. About 8 months ago, the chiropractor that I see who does gentle myofascial work on me, Dr. Maria Zazziata Synergy, she was so excited. She's like, Nicole, there is a new physical therapist on island. She has Ehlers Danlos Syndrome, and she also has POTS. So after about 8 months, I finally got to see her. This was my second visit with her, and it has been so incredibly emotional because she gets me, and her knowledge of Ehlers Danlos is extensive because she's went through her own journey, and she's went through the same experiences that I have, where doctors have not been educated on this, so they didn't understand, where people have dismissed her issues, including her mom, and she finally found the answers. And she ended up becoming a physical therapist. She said she didn't want to ever do that, but she was trying to help herself. And then she ended up practicing, and she just happens to be good at it. And she's better than good at it. She's excellent. She is an angel. So she did a bite and score on me where you assess for hypermobility. And she's like, without a doubt, you have that. Today, she's like, without a doubt, you have Ehlers Danlos syndrome. And she did acupuncture. I've had acupuncture in the past. The thing with Ehlers Danlos syndrome, which I learned, is you should only be doing 2 points at a maximum, because otherwise it's too much for somebody with a connective tissue disorder. So she did 2 points today. And she also found connective tissue specialists in the US who she is recommending to my pain specialist that I get referred to, which is good. And she's also recommending that I see a geneticist, which is good. Even though with hypermobility type Ehlers Danlos, no gene has yet been identified. There is a national conference coming up, and that's actually something that they're trying to work on. They're trying to identify that gene that affects so many people, and so many people are undiagnosed still today and suffering needlessly without answers. And then we did some stretches together, and these are some of the stretches that we did together, and we'll be starting Pilates together. But even things like my shortness of breath that I've experienced, she explained how that connective tissue affects breathing, and everything that I've experienced from the time I was a child, it all fits together right now. So Ehlers Danlos Syndrome, it's an autosomal dominant condition. So that means that 50% chance my children, Jack and Caitlin, could end up with it. I'm already seeing it in my son. With that said, as I learned today, doctors typically will not diagnose it in a child until teenage years. One, because they don't want to label them. That could be good and bad. Then we talked about my accident. So I was where I was at the time of my accident because I was speaking out against abuse in medicine. I was obtaining an evaluation. So as soon as my director of medical education found out that I would be transferring to a different hospital to complete my residency training, he started to state that I was incompetent, despite 2 years of him knowing me and 2 years of excellent evaluations. I had $250,000 worth of medical school debt at that time. I had not spoken out about the criminal sexual assault that I will be testifying about very, very soon. I had stayed quiet about that because I was told that everybody knew about my former dean's behavior and nothing ever changed. And he also touched me in front of his wife and other faculty member, and nobody said anything to him. So I stayed quiet about this. But now, after having graduated medical school, having $250,000 of debt, and having this man who I learned also ruined other doctors' careers, this is narcissistic abuse, I fought him. And he thought it was funny. He pulled me into his office, mocking me. So I went to the head of administration, and they told me to get my last performance evaluation. And I was working with a doctor, Dr. Michelle Zucker, family medicine doctor. So on December 15th, 2010, I went and I got my last performance evaluation like administration told me. On my way back to the hospital, 2 exits before exiting is when I got hit by a semi-truck at 65 miles per hour, and I should have died. And I've long questioned, I was anticipating dying. I long questioned if the hypermobility had part to play in me surviving. And today, my physical therapist agreed that that was probably a big part of me not dying in my accident, because that is a lot of force for an 18-wheeler to go through your body. And even after my accident, I looked like this. I didn't have any broken bones, and that is likely due to the hypermobility within my body, within my connective tissue. But the problem is that you have micro trauma inside, and you can't see it, and it is extremely difficult to heal. I then was treated at the hospital where my former director of medical education, who has since been fired, he was fired when they were subpoenaing my records from the hospital during my lawsuit with the trucking company, which fell in my favor in front of a panel of judges. So I have no idea if it's connected. I had some people when he was fired saying to me, thank you, because he was abusive to other people. And then I had some other people who turned their backs to me. And for me, it was an answered prayer, because he could no longer abuse his power and hurt people like he did me. And speaking out against abuse in 2010 placed me where I was at the time of my accident and nearly killed me. Yet, here I am again with William Strample, who was Larry Nassar's former boss. And I'm speaking out against abuse, and now I'm speaking out about the sexual assault that I kept hidden for reasons of people telling me that everybody knew about his behavior. And they did, because it was documented, and MSU still kept him on as a dean. And that documentation was before I even became a medical student. So I ended up being treated at the hospital where my director of medical education was, because like I said, I was only 2 exits away from exiting when I got hit by that semi-truck with an excellent evaluation. They ended up sending me home. They didn't do extensive neurological exam like they should have, which is another thing that my new physical therapist confirmed today. Very poor treatment. I ended up seeing Dr. Michelle Zucker the day after my accident, and she knew me from me rotating with her. And she's like, Nicole, you better get legal representation because you have no idea how this is going to affect you down the line. And she was right. I thought I would be back in medicine right away. I did not think that 8 years down the line, I'd be still fighting for my healing. And it has been a very, very, very hard journey. And I have, as a patient, I have seen doctors who, one, are persuaded by greed as independent medical examiners. Two, I have seen doctors that do not respect patients' choices and their ego gets in the way. 3, I have seen doctors who are abusive. 4, I have seen doctors who do not want to listen, and there's reasons that go into that with healthcare. Healthcare, the system is broken right now. Healthcare, doctors, their suicide rate is 2 times the national average for suicide. Doctors, their human rights are violated. They're not being respected. They're being pushed out by mid-level providers like nurse practitioners and physician assistants. They're not getting the respect that they deserve for the education that they earned. They don't have the time because of insurance companies and CEOs who don't have any degrees in medicine. They don't have time doing patient care the way they should, and that negatively affects patients and their lives. And it affects patients getting answers, which is really frustrating as a patient. The current climate within medicine is doing a lot of harm to patients. And I took the Hippocratic Oath in medical school to first do no harm, and I have seen as a patient, I've experienced harm as a patient, and I don't want other patients to go through what I've gone through. So I am hoping that further along this journey, part of my purpose and calling in life is to educate people within healthcare, including doctors, about Ehlers Danlos and about patient care, and bring more empathy into medicine. I've also had some ignorant people tell me I'm not a doctor, and that's laughable because I earned my degree in medicine, and I didn't have an undergraduate degree in biological sciences. I had to take prerequisites to get into medical school, like organic chemistry and microbiology, but medical school, I have an undergrad degree in psychology. I have a bachelor's of science in psychology. So medical school for me is the first time I had anatomy and physiology or pharmacology or genetics I had for the second time in medical school. But I worked hard to become a doctor. And I was the first doctor in my family. So for somebody to tell me that I'm not a doctor for a degree that I earned is, one, very disrespectful and laughable. I may not be currently working in clinical medicine, but let me tell you what I have learned as a patient, what I've learned through this journey, 8 years, is far more than I could have ever learned within any residency program. So I am proud of the fact that I am a doctor. And I'm also proud of the fact that I have an undergraduate degree in psychology, because I think it's really important. Social sciences are really important for doctors. And I also, in between undergrad and medical school, I was a certified personal trainer and group fitness instructor, and I trained for figure competitions. So I gained a ton of nutrition knowledge. And in medical school, I had exactly one 45-minute lecture on nutrition. That's it. There's a big problem there. Let's see what else I have. Okay, so through Hartford, this long-term disability. Hi, Laura Parrish. Thanks for joining in. Hi, Dustin. Thanks for listening in. I'll get to your comment in a second. There's just a couple more points that I want to cover. So since my accident, I have Hartford long-term disability insurance. That I gained when I was working at St. John Hospital. Had a 17-year policy. They have not paid me my benefits in over a year now. That's over $40,000 that they have not lived up to their end of the commitment. They harassed you. They had an investigator follow me who actually wrote in his report that he tried to look through my blinds, but the blinds were drawn. Talk about violating a woman's privacy. Talk about making somebody who deals with chronic pain feel even more vulnerable. He was in the grocery store just steps behind me. And when we moved here to Grand Cayman in 2012, I had to write a 9-page rebuttal to his ridiculous report that was full of lies, like saying that I washed my car when I went through a drive-in car wash and somebody else washed and dried my car. Those were the type of things that I saw. But the one with him looking through my blinds, that was such a huge violation of privacy, and it made me feel so unsafe as a woman who also deals with daily chronic pain from this accident. That was no fault of my own. So anyway, that case, like I said, is at the level of the U.S. federal court. But before they stopped paying my benefits, they had sent me to an IME, and I saw Dr. Caroline Courtley here, who is a PM&R, physical medicine and rehab doctor. And she is extremely gifted, and she also has extensive knowledge about Ehlers Danlos. She has treated patients with Ehlers Danlos in the past. Within the first couple minutes of talking to her, here I am, I come in, I start presenting my, past medical history, and she's like, Nicole, can you just be a patient for a minute? And I'm like, I don't know how to be a patient. She's like, Nicole, has anybody ever told you you're gifted? And I'm like, well, after my accident, I had to have extensive neurocognitive testing. And Dr. Inwald, he's a neuropsychologist in Michigan, he specifically told me, he said, Nicole, I do not want to write that you had a traumatic brain injury, a mild TBI, a concussion with loss of consciousness, despite having post-concussive syndrome and the symptoms that go along with having a concussion. He said, I do not want to write that you have had this because you tested higher than any doctor I've ever tested neurocognitively who has not had any traumatic accident, aka a concussion. And he said, and I don't want that to be a stigma in case you ever go back into clinical medicine. So I shared that with her. And also Dr. Robertson, who did a spine surgery on me after my accident, who also spoke in his report about the ligamentous damage from my accident. He said to me, quote unquote, these are his words and not mine, because it's still uncomfortable for me to say this, but he said, Nicole, your biggest problem along your journey is going to be the fact that you are going to be more intelligent than those that are treating you. As I told Dr. Courtley, from the time I was a little girl, I was told I was stupid. So imagine going through your life, working really hard, hoping you're making people proud, but subconsciously you have that scar and that wound that's below the surface bubbling when you were told that you were stupid repetitively and other really hurtful names. And even though you're highly educated and you gained successfully 2 very respectable degrees, and even though that you have this neurocognitive testing, and then you're told that you are intellectually very gifted, and even though you had this doctor, this orthopedic surgeon, state that you are intelligent, you still don't accept that because of those underlying scars and those words from the time that you were a little girl. So Dr. Caroline Courtley in 2017, when I had that, because of what I go through with the Hartford group, she's like, Nicole, has anybody ever told you you're gifted? And then she started to explain more to me in terms of giftedness. And then I did a lot of research on giftedness. When I was in 1st grade, I had a teacher write on a report card that Nicole is a bright little girl, but she talks too much. Talking too much, being too sensitive, those are actually traits of giftedness. Being very empathetic, being intuitive, having this love of learning, never feeling like you can learn enough. Those are all traits of giftedness. So today, with the new physical therapist, she's like, Nicole, if you weren't gifted, you wouldn't have got to this point. So it's overwhelming. It's overwhelming seeing all of these pieces fit together after so many times throughout my life since childhood being dismissed by people who either weren't educated enough or didn't see how the pieces fit together. And on Facebook and on Instagram, I shared a list of, I just sat down with about, and pulled up a list of some of the different symptoms that I have had since childhood. And let me see if I can find that, because I'd like to go through that and just show how all of the pieces fit together, if I can find it without making anyone wait too long. So here it is. Okay. So I had shared, after meeting with the new physical therapist the first time, this is on May 13th. It's so interesting that so many of these answers are coming together during Ehlers Danlos Awareness Month. So I put, as I think back to the weekend and my new physiotherapist who has had her own journey with Ehlers Danlos and POTS, and as I think ahead to the tilt table test that I have on Saturday, which has now been rescheduled till June 8th, I also think back to different issues that I've experienced throughout my life that have been written off, dismissed due to people, including other doctors and family members, simply not having the education or knowledge or desire to fit the pieces together. Here are some of the pieces. 1, easy bruising. Just this weekend, I had a vessel blow up my whole wrist. It was so painful. My whole wrist was black and blue, and it's finally cleared up. Doctors in the past, including in high school, dismissed this, and Ehlers Danlos wasn't even on the radar. My family history. I have easy bruising through my mom's lineage. My grandma died suddenly at age 64, and from what I was told, it was believed to be due to an aortic aneurysm rupture. However, I can't confirm that. 2, I have human Gumby type flexibility. It helped me as a figure skater. I could do tricks that other people couldn't do. But again, you're not usually supposed to do these tricks and show people, but I'm extremely, let me see how, okay, let me see. Extremely hyper, this is really hard to show. There we go. I'm extremely hyper mobile. That's with my finger here. That's not normal. Okay. And there's other things like how much skin you can pull away, really elastic. So that's just some of them. 3, I had my nose cauterized several times as a child due to bloody noses, and that's due to the fragility of the vessels. The ENT never even considered how that could be interconnected with other issues. 4, poor wound healing. I had knee surgery when I was just out of high school, and I had a terrible time. They had to send me through physical therapy a couple times. My knee swelled up, and after my accident, again, 8 years past getting hit by a semi-truck. Poor immunity, cold hands and feet. These are some of the common things with people with Ehlers Danlos. GI issues similar to irritable bowel syndrome. 8, chronic sinusitis. 9, periodic sharp chest pain with inhalation. I was having it that day. That can also be related to the mitral valve prolapse and regurgitation, which is very common with people that have Ehlers Danlos, the hypermobility type. 10, stretchy elastic skin. I showed you that. I actually saw a dermatologist who taught a dermatology class at my medical school. I had her as an instructor, and I saw her as a patient, and she commented on how elastic my skin was, and even she didn't even think about Ehlers Danlos syndrome. Velvety skin. She noted this as well. That's the one positive. It makes you look younger. I'm 37. Most people never think I am 37. I've gone through a lot in 37 years of life. 12, difficulty regulating body temperature. That could be related to the POTS syndrome. 13, mitral valve prolapse, which was just diagnosed. 14, mitral valve regurgitation, just diagnosed. Both heart issues likely secondary to Ehlers Danlos, the collagen defects, and the hypermobility. 15, chronic pain set off by trauma, getting hit by the semi-truck on December 15, 2010. Trauma, including head injuries such as concussions, can set off POTS, postural orthostatic tachycardia syndrome, which is the reason for my upcoming tilt table test. Chronic pain is common with Ehlers Danlos and POTS. Pain improved during my pregnancy, which I learned from Dr. Quartley, the rehabilitation doctor that visits here from Canada. That is actually a common find with people who have Ehlers Danlos. Their pain improves with pregnancy. And that's also related to the fact that when you are pregnant, your progesterone increases. But then after pregnancy, the pain that I had, just bending over with a little 6-pound baby and trying to get up, one time I almost couldn't, and I was in tears because no mom should ever have to experience that pain. That was really hard for me. 16, dizziness with changed position, getting up from a seated or lying position, and then with prolonged standing, nausea, numbness and tingling, vision issues, and feeling like I will pass out. I did pass out in middle school, and the EMS transported me to the hospital in my Christmas pajamas, and that was embarrassing. Doctors could not figure out a diagnosis at that time. This could have been secondary to POTS. These symptoms are what have been significant lately, and those are the things that could have been a big reason of me being in the ER before Easter. 17, chronic UTIs, bladder issues since childhood. I ended up hospitalized with pyelonephritis, kidney infection from ascending UTI in 4th grade. Those are painful memories even till today. Viral infections can also set off POTS, postural orthostatic tachycardia syndrome. 18, periodic shortness of breath and tightness in chest, racing heart. In the past, it was dismissed as a medicine-induced side effect. However, I take no medication now, and I still, even today, with no CBD oil for weeks now, with no medication, still dealing with the dizziness and the faint feeling, which is sometimes scary when you are taking care of little kids. 19, tension-like headaches. Headaches are common with Ehlers Danlos syndrome. They have been written off and dismissed, and even in medical school. Some of my issues are obviously secondary to musculoskeletal issues since my accident. 20, pain in my hands and fingers. It hurts to hold a pencil. When I was growing up, I ended up playing violin semi-professionally. It hurt to hold my violin bow. It hurt to press down on the violin strings. But I thought everybody had that, and I wasn't raised to be a complainer. In medical school, I'm an osteopathic doctor. We did rib raising techniques where you place your hands underneath the patient's ribs, and my hands hurt so bad doing that. But again, nobody else complained of pain, and I wasn't one to complain. Difficulty typing on, say, this phone. My hands flare up. If I type onto the keyboard on the phone for very long, my hands become extremely painful. In the past, I've been unable to open, like, this was an old spaghetti jar that I have repurposed. Opening a spaghetti jar, a lot of times I can't open them. Opening the door sometimes is too painful for me. Opening a water bottle, most of the time, I have my husband do it because it's not easy for me to do. And the thing that has made this hard, and my chiropractor has mentioned this, the thing that has made this so hard is that I look fine. People look at me, and I'm not one to talk about my pain. This is very abnormal for me to talk publicly about all of this, but I hope it helps. And since this is Ehlers Danlos Awareness Month, there is a greater purpose in it. But even recently, here in Grand Cayman, there was a post on one of the news media sites where people don't respect the blue space, the handicap space. And they'll park there, either they don't have a handicap plaque or they'll park blocking it so people who do have handicap access can't get into it. And I wrote a comment and I said, here I am. I've been given, in Michigan I had a handicap sticker. here I am. I've had the paperwork 2 times to get a handicap access here in Grand Cayman, but I can't bring myself to it because I look fine and because I don't want to be judged. I don't want to be wrongly judged. I don't want my car damaged by people who don't understand hidden disability because on the outside I look fine. Dr. Maria Zazzi, my chiropractor, she said, as bad as it sounds, if I didn't look the way I looked, I probably wouldn't be treated the way I've been treated by defense attorneys. Hartford, I wouldn't go that far because what they've done to me, they've done to everybody else. But most people are not a doctor. They don't have the education and insight that I have, and they don't have access to a disability attorney. So people are harmed, and people do not receive the benefits that they should receive, that they deserve to receive, because they harass them so much, and then patients just don't know where to turn. Or doctors don't have enough time or the desire to help patients. And I've seen that, and it's really sad, and it's really hurtful being a doctor who went into medicine. I'm having chest pain right now. Went into medicine, who went into medicine for the right reason, and then to see doctors who haven't had their entire life disrupted, not being grateful for that position and that honor and that privilege to treat patients and do right by them. That's been hard for me. So that kind of gives an overview of where we're at. And like I said, I wrote a book. The manuscript I finished in 2017, I thought, but it's just been sitting in my Dropbox. And I'm coming to realize now that that book's not completed. There are a couple more chapters left to write. My book starts with abuse in medicine, and then it brings me back to abuse throughout my life that I talk about, and healing and forgiveness and humility and courage and cycles of abuse and those cycles being broken. And I talk about my accident, the details of my accident, my experiences as a patient, the darkest moments that I've experienced along this journey where I questioned why I had to survive, and I thought it would have been easier not to have. And it's going to end up with chapters that include talks on justice in medicine. Because like I said, I'm going to be testifying in this criminal case here really soon. And I don't know the outcome of that trial, but that's not in my hands. I'm just going to do my part. I can't stay silent to abuse. I couldn't stay silent to it from the time I was a little girl, and I saw positive change come through my voice, and I can't stay silent now. My former medical school dean was Larry Nassar's boss. Larry Nassar sexually abused over 505 little girls and young women. That's been all over the national media, including Olympic athletes, Olympic gymnasts. Having watched all of those impact statements, and then seeing Rachel Denhollander's open letter to my former medical school dean who sexually assaulted me, he mocked her. And I thought then, why wouldn't he mock her? He was a sexual predator enabling another sexual predator. And I was so convicted in my spirit at the time to break my silence. And the thing with me is I've been put in this unique position. What some doctors would fear to lose in regards to speaking out against this abuse, institutional abuse, widespread abuse, I've already lost all of that through my accident. I have no reason to stay silent. I have no reason not to speak truth in regards to this. I can't lose my career. It's already been affected by speaking out against abuse in medicine in the past. So I look forward to seeing how that chapter ends up in my book with justice in medicine. And I'm also going to have a chapter with Ehlers Danlos and fitting all these pieces together. And hopefully that will open up opportunities for me to help other patients who haven't felt heard, who haven't felt validated, who've been told they're crazy or they're malingering or they're making it up because doctors just simply don't understand. I hope that through my voice and my experiences and my writing, I can teach other doctors and other medical students to look out for Ehlers Danlos and connective tissue disorders. So people don't go 8 years. So people are not first diagnosed after the age of 40 because it sucks. And then I hope that there will be another chapter on restoration and seeing how this entire journey, seeing more of the pieces fit together. I think there's still more of this book that hasn't written itself yet, but I really look forward to its completion. My physical therapist, she's going to be one of the beta readers, and she's going to help me do my chapter that talks about Ehlers Danlos Syndrome. And she's from the UK, so it's nice that it will have a wider spread and wider reach. So I think that's everything. Let's see what Laura has here. Thank you for being patient with me. Hello from Michigan. Laura, cool. I'm from St. Clair Shores originally, so it's nice to see another Michigander. I will be in Lansing soon. I hope it's warm by the time I come there because it's always hot in Grand Cayman. I have a friend with Ehlers Danlos Syndrome and have friends in my primary immune deficiency disease support who have Ehlers Danlos Syndrome. As someone with a rare disease and a zebra, would you agree that doctors, PCP, need to look beyond the norm when presented with patients that present with conditions that are out of the norm? 1, yes. 2, I am an osteopathic doctor. We have the same exact training as an MD. My first 2 years of medical school were with the MD students at Michigan State. What differentiates us from an MD, and MDs and DOs in the US, they all work together. And we all really practice the same. A lot of DOs don't even do osteopathic manipulation medicine, but there's definitely with chronic pain and Ehlers Danlos, it's a huge tool. It's a really good resource. Touch, gentle myofascial release is a really effective tool for people like us. So for me, I applied to one medical school. Oh, did I freeze? Okay, so I thought I froze. So I applied to one medical school. I did early decision program. I had met other osteopathic medical students that rotated at the psychiatry office where my mother is employed. So I got to learn about the philosophy. My undergrad degree is in psychology. I worked as a certified personal trainer and group fitness instructor before going to medical school. So the holistic, treat the whole patient, get past the symptoms and get to the root cause is what drew me to osteopathic medicine. And as a patient, being my own patient advocate, that philosophy has helped me. It's helped me fight, pushing forward, seeking more answers, trying to get healing, because I don't want to live in pain for the rest of my life. I want more healing. I want to feel better. I believe my children deserve more of me. I fight for my children and for my marriage, which has been greatly affected by everything. When your intimacy is affected because it hurts to be touched, those are the psychological components that most doctors don't even think about. But my new physical therapist, who also has Ehlers Danlos Syndrome and POTS, that was one of the first things that she asked about, were things that other doctors and other healthcare professionals never even considered asking me. So yes, you have, and the problem is doctors don't have the time or the energy, and they're drained, and they are being disrespected and abused. So it's really having a negative effect on healthcare and doctor-patient relationships and patient care in general. So yes, get below the surface. And I will go into more specific depth, and I did in my manuscript that I wrote. So I cannot wait until that book does complete itself, and hopefully it can help a lot of people. But again, that's outside of my control. I'm just doing what I feel led to do every step along the way. And another thing, a woman wrote to me, and she was like, one of my other posts had really resonated with her, and she's like, I'm so sorry that you've had to go through what you've gone through, but I applaud you for using it to help other people. And for me, I am just so grateful for the second chance at life. I didn't have to be afforded the second chance at life. People have died from accidents that are relatively way less than what I survived through. But I did live, and I've come out of the darkness, and I experienced joy and peace despite pain. And it's an honor, and it's a privilege to be alive and to be able to use all of this to help other people. So let me continue on here. So yes, doctors, PCPs, look beyond the symptoms, please. Need to look beyond the norm when presented with patients that present with conditions that are out of the norm. Rather than hear horse hooves, they need to hear and see the zebra hooves. Like you, I have been affected by a head and neck trauma injury when I was 17 years old, and over the last 35 years, my life has been affected by that accident in every aspect, from test treatment, wasted doctor appointments with doubt, pain management, unemployment due to unpredictability of my chronic illnesses, multiple chronic illnesses, pain related to the accident, i.e. occipital neuralgia, cervicogenic headaches, fibromyalgia. Thank you for your insight and sharing your journey as a patient from a physician standpoint. We need more awareness to the chronic pain community. Thankfully, now at 54, I have a medical team that listens, are informed, support it, listen, and believe in me. Laura, that is amazing. I, too, didn't listen to the doctors who told me that I would just have to live with my pain. That wasn't an acceptable answer to me. I didn't listen to the doctors who told me they didn't know what to do with me. That was not an acceptable answer for me. I kept seeking more answers. I keep seeking more healing. I haven't given up as my own patient advocate, so I applaud you. And now, currently, all of my treating practitioners, my pain specialists, my chiropractor, my physical therapists, they're all women, and they're all excellent. So, Laura, I should also add to my list of residual conditions from that head and neck injury was cervical stenosis, bulging disc in the C4 to C7, in which I finally had to succumb to ACDS C4 C7 fusion after 35 years in 2017. Of course, permanent whiplash. I can understand that. I got hit from behind from the truck. That was the first of 4 impacts. So I definitely understand whiplash and then the consequent concussion from that. Surgery may have fixed my cervical stenosis and bulging herniated disc, but the cervicogenic headaches and occipital neuralgia migraines continue due to the accident. Unrelated to my accident, I have MGUS and specific antibody deficiency, which I receive IVIG monthly. I hope that helps you. I know that that helps another person that I am connected to. I, too, also have MVP, mitral valve prolapse. Since my accident and my ACDF, my dizziness, vertigo, nausea have greatly increased. You sound like you could have Ehlers Danlos and POTS. I'd look into that more yourself. The worst feeling is when doctors, friends, and family assume that just because you look fine, dress, makeup, out and about. Oh, I took a shower. At first, I was like, I'm just going to go on looking like I look. But then I was like, no, I kind of smell. I'm going to take a shower, look presentable. You're fine and you're faking. Living with multiple, unpredictable, invisible chronic illnesses need more awareness and understanding, especially in the medical community. Silent no more. I live in, oh, cool, East Point. I grew up right around East Point, and my grandma, who was the one who passed away at 64, who had easy bruising, who the Ehlers Danlos runs through that lineage, I grew up all the time in Warren, Michigan on Weller Street. So I'm super familiar with East Point. That's really cool. Thanks for joining me here. And thank you for sharing. Oh, 85 degrees. That's good too. That's like Cayman weather. So cool. That's nice because I don't want to freeze my butt off when I go to Michigan. But anyway, I relate to a lot to most of what you shared, Laura, and I'm proud of you for not giving up, because I can see why people do give up. And I can also state that when I was a medical student in the ER, I would see the stigma that pain patients got. And that's really unnecessary and unfair, because some of those patients are just seeking answers and they're seeking healing that they haven't been able to get, and they're desperate. And there shouldn't ever be that stigma associated with patients, and patients should always be treated with dignity and respect. My husband's getting back right now, which means that my kids are going to come back in and they're going to want their mama because they're used to having me. But what I wanted to say really quick is I never could have imagined before experiencing myself how much having head, neck, back pain would affect absolutely every single aspect of your daily living. Having that insight as a patient, being a doctor, has really opened my eyes. So anyway, they're coming in right now, and I'm going to get off here. Thank you for everybody who's tuned in or will listen at a later time. I hope this serves a good purpose. Please share this with other people who may need that validation. Have an amazing remainder of your day.